Okay, folks, we're going to get started. Hi, everyone. My name is Sue Peshin, and I serve as President and CEO of the Alliance for Aging Research. Thanks for joining us today. Please feel free to use the Q&A chat function to enter your questions as we move along, and we'll get to them after the presentations. And when you enter a question, please identify yourself and your organization or press outlet along with your question. So by way of background, since April of 2022, the Centers for Medicare and Medicaid Services has uniquely locked down Medicare beneficiary access to all FDA-approved early Alzheimer's therapies. CMS has done this by applying an overly restrictive utilization management tool they created that's called Coverage with Evidence Development, or CED. Under a CED policy, Medicare indiscriminately mandates that beneficiaries have to enroll in clinical studies for coverage of selected treatments, or else coverage will be denied. The program also imposes strict eligibility criteria on the health professionals and hospitals that can qualify to collect data and run the studies. The net effect is that only a small fraction of Medicare beneficiaries have gotten access to the two currently available early Alzheimer's treatments, Leqembi and Kisunla. No other FDA-approved drugs for on-label use in other disease areas have been subject to CED. Other payers have been following Medicare's lead, including TRICARE and Cigna. Several other private payers are using complex guidelines to deter utilization. So we wanted to find out whether likely voters believe people with Alzheimer's should be treated differently from those with other diseases. We wanted to know whether they think it's right or wrong for Medicare to require beneficiaries living with early Alzheimer's to have to participate in clinical research as a condition of coverage for FDA-approved medicines. And what would people think if they had to pay more in health insurance? Would they do that in order to get better access? And we wanted to know whether voters think Congress or the president should get involved if CMS doesn't change its tune. This poll was expertly run by Lake Research Partners and Public Opinion Strategies, and it was commissioned by my organization, the Alliance for Aging Research, the Partnership to Fight Chronic Disease, and Us Against Alzheimer's. And we're fortunate today to have speakers Celinda Lake and Neil Newhouse to present the results. Celinda Lake is president of Lake Research Partners, the most consistently accurate and consistently progressive democratic research firm in the country. And Neil Newhouse is a partner and co-founder of Public Opinion Strategies, a national political and public affairs research firm, which has been described by the New York Times as, quote, the leading Republican polling company in the country. And Celinda and Neil, thank you for joining us today, and welcome, and the floor is yours.
Thank you so much. And it's really an honor to be part of this research and part of this research over time. And I want to acknowledge how great it is to be working with POS, and also acknowledge our full team, Alicia Snell, a partner in the firm, and Jesse Klein, the head of this project. And Jesse is on the call as well. We did a sample of 2024 voters with oversamples of African American, Latino, and battleground voters so that we could look at all of those subgroups. We're going to concentrate on the big picture today, but very, very glad to share any crosstabs with you on this call or later if you want it. So what are the major conclusions? Alzheimer's disease is personal, and this is really an insight that Neil has had for a long time. There's just an astounding number of people, 63%, who have personal connections to the disease of one kind or another, or dementia one kind or another. And we'll go into that in more detail. People overwhelmingly support requiring Medicare to cover the cost of FDA-approved Alzheimer's therapies. And they're frankly quite surprised that it's not covered now. They don't understand any reason why it wouldn't be. And when the rubber hits the road, as Sue said, when we said, okay, this is going to increase your insurance premiums, people said, yeah, I still support it. And part of that is because people have so much personal experience with this issue that these are not really policies in people's mind. These are more core values. We have upwards of 9 in 10 voters supporting this. 73% of voters are willing to pay $5 more a month for health insurance to cover FDA drugs and therapies that can slow the progression of Alzheimer's. And 50% are very willing to do that. And we look at the intensity here as well as the overall number. There's urgency to this issue. And again, this is an insight that Neil was particularly emphasizing. 9 in 10 voters saying Medicare should immediately stop rationing care to people living with Alzheimer's and provide access to the drugs and therapies, the same way they do for medications that treat all other diseases. And again, the kind of level of personal experience gives the voters real urgency here, as well as their just common sense belief that why is this a major problem? Why is this being treated differently from other areas? People want parity in access to Alzheimer's drugs and therapies. 9 in 10 say Medicare should immediately cover the costs of FDA-approved Alzheimer's drugs and therapies the same way they do medications for other diseases. This is a completely bipartisan issue. Every single demographic and political group is wildly in favor of this. And frankly, this in a polarized America, you just don't see numbers like this. Again, this isn't really a policy or a choice in people's minds. It's a core value. And people don't understand why we would require participation in clinical research to get coverage. In fact, they think that's kind of their view is, isn't that illegal? Why is that even legal to do that? So let me pause here, Neil, if there's anything you want to underscore in the key takeaways, and then we'll go through the data.
No, the only thing I want to say up front is I'll echo your comments about it's a pleasure to work with you, your team.
Thank you.
And Susan. There are very few issues in current U.S. politics where Republicans and Democrats see eye to eye. This is one of them, and it's a pleasure to work with Slinda to share that with you. But if we can go to the next slide. So these two slides reinforce the point that Slinda made that Alzheimer's is personal. On the left-hand side, 63% of voters reported having a personal connection with the disease, including more than half who have a family member with Alzheimer's or other dementia. And this transcends partisanship, ethnicity, age, gender. 54% of voters under the age of 30 have a friend or family member with dementia. 60% of Democrats, 69% of Republicans. I mean, it cuts across the board. But it's not just knowing someone who has dementia. On the right-hand side, 1/3 of Americans say they have cared for or provided assistance to those impacted by Alzheimer's or other dementias. This is a disease that many Americans have direct contact with. And even 25% of those people we interviewed under the age of 30 say they have provided care or assistance to someone with Alzheimer's and other dementia. It just cuts across the board in terms of how it impacts Americans. So on the next slide, Americans they're clearly concerned about the disease. They reject the notion that Alzheimer's is a normal part of aging by 71-7. At the same point in time, 2/3 say they are very concerned that they, a friend, or a family member could develop the disease, including 61% of younger voters. So this is, it's remarkable. It penetrates the breadth of this disease and the breadth of its impact on Americans and the U.S. electorate is incredible. So now I'm gonna hand it off to Slinda, who's going to show data in support of requiring Medicare to cover the cost of FDA-approved drugs to slow the progression. Slinda.
Thank you so much, Neil. So voters support Medicare coverage of FDA approved drugs and therapies that slow Alzheimer's. And 87% favor that, 78% strongly favor it. One of the things that's really interesting throughout all of this data is that people know exactly what we're talking about, and they have minuscule numbers of people who are undecided about the policies. People have made up their minds, and they made up their minds totally in favor. In fact, the opposed number is under the margin of error here. So basically, no one is opposed to this policy. And again, you'll see on the right-hand side, those numbers in the first column are not total favor. They are strongly favor. Men and women agree. A 75% of under 50 agree. 81% of over 50. Whites and people of color agree. Democrats and Republicans agree. Urban and rural agree. In fact, it's a big issue in rural America. And of course, if you have any kind of personal connection, you're very, very strongly in agreement. So it is totally, you want an issue that unites America? This is an issue that unites America. But of course, it's easy to say you support something. Let's make it a tougher question. Let's ask people, which we did in the next question. Do you support it even if it increases your health insurance premiums? Now, we are asking this at a time when people think their health insurance premiums are going up. And for women, food and healthcare are the top two things that they're worried about rising cost of living. Everybody believes that healthcare is getting more and more expensive. And yet you have 82% favor, 65% strongly, a little decline in intensity, but these numbers are stronger than any politician or political party we have out there, or any government agency for that matter. And again, if you look at the right-hand side, you will see just enormous agreement and intensity across every demographic group. A solid majority of every single political and demographic group is saying, I strongly favor this, even if it increases my premiums. It's a very, very, very consistent policy. This has been true now in 2 waves of data, and a very strong policy. We then asked, okay, so you say a vague, you're for increase. Let's put some money on the table here. Let's say would you be willing to pay 5 more monthly for health insurance? And remember, we're polling on this at the height of concern about rising cost of living, at the height of concern about inflation, where you have 2/3 of voters who say wages and salaries are not keeping up with inflation, and you have 73% of the people who say, yes, I would be willing to do that, 50% strongly. And again, you have this enormous consistent opinion with nearly a majority in favor and less than a quarter against this in terms of their own personal pocketbooks. Neil, let me turn it over to you.
Okay, if we can stay on that side just for a second. I just wanted to reinforce here, we have 68% of Republicans and 78% of Democrats say they'd be willing to pay $5 or more a month. I mean, I think when Celinda showed the other data in general, the willingness to pay higher health insurance premiums, when we actually put a dollar amount here, it does make an impact. And almost 3/4 of Americans said they'd be willing to do this. And why the strong support here? The strong support is because this disease is so personal to many Americans. They've seen firsthand the debilitating and personal nature of this disease, how it strips loved ones of their memories, their personalities, and their sense of self. And they see a need to address this. And that's why you see such a high willingness here. If you go to the next slide, this simply makes the case that there should be no preconditions for access to the needed drugs. Voters agree the drug should be provided without requiring the prescribing physician and patient to participate in clinical research as a condition of coverage. And about 69 to 19, and a majority of Americans strongly favor it. It's overwhelming. And the next slide, voters want action. If Medicare won't take the necessary steps, Congress and the president should act. By 78 to 13, Americans believe that Congress should step in if Medicare doesn't cover it. By 73 to 20, they think the president should step in. What's interesting here, what's the difference between the two? Well, it's Republicans. The difference between the two is Republicans, they are automatically positioned against the current president, which actually makes their 63% support all the more impressive, based on a president that only like 12% of Americans, 12% of Republicans approve of the job he's doing. So on the last slide for me is the impact of this on vote. The bottom line here is the issue can draw votes to a candidate by a 58-3 margin. Voters say they're more willing to vote for a candidate who supported requiring Medicare to cover FDA-approved Alzheimer's drug, 58-3, with 30% much more likely. Democrats were 77-1, independents 47-4, Republicans 43-4. And on the flip side, on the right-hand side, we just asked the kind of reverse. If a candidate for elected office opposed requiring Medicare to cover FDA-approved drugs, would it make you more likely or less likely? So it's a net negative. 37% say they'd be less likely and 23% more likely. So it can draw votes to a candidate and it can cost a candidate votes. A plurality of voters across party lines said they would be less likely for a candidate who opposed this. So let me turn it back to Slinda to close this out.
Yeah, and if I can say this too, Neil, I think one of the reasons why the less likely statement is a little bit muted is because people can't understand any reason why you would oppose this. So they're thinking, wait, is there some secret thing I don't know about here? Because this doesn't make any sense to me. The last thing we tested were a number of agree, disagree statements about how to talk about this issue, but it's also useful to look at this in terms of how people are approaching it. Is it a policy? Is it a commodity? Is it a value? These statements here, the dark blue is the people who strongly agree with the statement. The adding on to the light blue, the people who totally agree with the statement. I mean, not this many people agree that the 4th of July is a good holiday in today's America. This is how strong these numbers are. When we're doing campaigns, Neil and I and Jesse, we think we have a good number when we have 40% strongly agree and 60% agree. As you can tell, these top statements are way beyond this. Now, we asked a whole bunch of statements that we haven't included here, and all of the statements got at least half of the voters who strongly agree, but these are the top testing statements. 92% of voters agree that Medicare should provide all beneficiaries access to FDA-approved Alzheimer's jobs, just as they do to FDA-approved drugs for all other diseases. 78 strongly. Again, people cannot understand why this isn't the rule now. 90% of voters agree that Medicare should cover all FDA-approved drugs and therapies and allow patients and their doctors to make decisions based on risk benefits and individual health needs. 77% strongly agree. And of course, this is a sentiment about doctors and patients making their own medical decisions that is really heightened in the country right now. 89% of voters agree that Medicare should immediately cover the cost of these FDA-approved drugs. 77% strongly agree. As Neil has said, this is personal, this is urgent, and people support the policies even when the rubber meets the road of being told it would cost them more. And finally, 78% of voters agree that government should not require patients to participate in medical research studies on any FDA-approved drug in order to get access to the drug. 65% strongly. And when we've tested this in other work, people wonder, why is this even legal? Isn't this unconstitutional to require this? These numbers are at core values. This is not a policy discussion in the public's mind anymore. This is a consensus value in the public's mind, and they're looking for action from their politicians and willing to reward and punish politicians according to the action they take. So let me pass it back to Sue, and very glad to take your questions, your comments, and as well as additional thoughts from Sue and George. And Sue, I apologize for interrupting. You're muted.
Thank you. Sorry about that. Okay. So thank you both very much. It's now my pleasure to introduce George Vredenberg, who serves as chairman and co-founder of Us Against Alzheimer's, to give us some of his thoughts.
Thank you, Sue. Thanks for asking us to participate with you and partner with you on this work. And we were excited to do so because this work with two prominent researchers and pollsters is so impactful in terms of the ability to get at what American attitudes are. As you just heard, 2/3 of voters in America know someone living with this disease or another dementia. Now, just think of that. The likely, you're going to ask Linda or Neil here, the likely voters in this year's election, maybe 150 million, something in that order of magnitude. So if you say 2/3 of voters know someone living with Alzheimer's or another dementia, you're talking about 100 million Americans. And more than half of those, for more than half of those people, which would be 75 million, it's in their family. So, for anyone who has experienced this disease, this is a painful disease because it lasts so long and because you see a loved one disappear before your eyes. Every one of those adult Americans has been paying into Medicare their entire lives, their entire working lives. And the notion that somehow when they really need it most, that their insurance company is pulling the plug on them, requiring a bunch of hurdles for them to jump through in order to get access to the insurance policy they thought they had gotten and a promise they had made by the federal government. They are angry. They are upset. They are confused about why that should be the case. Alzheimer's is not a normal part of aging. The majority of American people know that. But more than that, this disease scares the hell out of us. Nearly 2/3 of Americans are worried that they or a loved one could develop this disease. At Us Against Alzheimer's, we're focused on prevention, early detection, diagnosis, and treatments. So let's talk about treatments. Here we have two disease-modifying drugs that will slow down the progression of this disease if taken in the earliest stage and potentially delay our progression to a moderate stage of the disease by more than a year. For the time with family, that is extraordinarily valuable for patients. But we are getting not just the innovations in drugs, we're getting them in new blood tests, which will lower the cost and increase the access of diagnosis to patients. And Medicare has just announced that it's going to reimburse a blood test at about 1/14 of what it reimburses for a CSF or a lumbar puncture test. Now you say to yourself, what in the heck is Medicare thinking? Here it is that we have a lower cost diagnostic blood test, and it's proposing to reimburse for that at a small fraction of what it will reimburse for a much higher, much less accessible, and a much bulkier kind of diagnostic process. Medicare seems to be declaring war on Alzheimer's patients, and that is simply unacceptable. Never before has Medicare refused to cover the costs of an FDA-approved drug. That is, until the first Alzheimer's disease modifying drug came on the market. Now, unlike any other patient group or any other disease condition, people living with Alzheimer's have to jump through these regulatory hurdles and conditions to getting access to the insurance that they thought they'd been paying into for all of their lives and relying on to help them when they did get a disease. And a medicine that would serve it, and a diagnostic that would permit them to find out whether they had the disease or not. So along party lines, across party lines, all 97% of voters believe Medicare should treat Alzheimer's like any other disease and provide access to FDA-approved medications. Well, of course, we've been paying into Medicare for our lives. More than 8 out of 10 are willing to pay higher insurance premiums to do it. This polls a warning for any candidate running for office, be it president, state house, Senate, House of Representatives. Voters expect you to take this disease seriously. They expect our leaders to treat it that way. They can start by increasing access to drugs that allow early stage Alzheimer's patients to live longer, healthier, and happier lives, and to be able to access new innovative blood tests that will tell us whether or not we have the disease and thus ought to assess whether or not to take these medicines. I send it back to Sue. This is something where 2,000 of us are progressing from mild to moderate disease every day. This is a disease where 2,000 or more people are dying of this disease every day. and want the additional time with families that these drugs can offer, and want the ability at a much less expensive and more accessible means to get blood tests for it. So I am 100% understand what Celinda and Neil are telling us. The patient community we represent is in pain and wants the insurance that they bargained for.
Thank you, George. I'm a little partial, but that was awesome. So we're starting to get some questions in, and I'm gonna volley the first question back to you, George. The question is there any indication that a Harris or Trump presidency would be more likely to ease CMS coverage restrictions? And I'm happy to answer that after you as well.
Well, both candidates have said that they aren't going to touch Medicare, and that they'll assure the American people that it will continue. But neither has spoken about this issue. Intriguingly, Mr. Trump's father died of this disease, but he hasn't spoken of it. And so he has seen it up close and personal. But I do not know whether what they would do to react to this. I think Medicare is reacting to the numbers of people that are affected by this disease, or the perceived number of people affected by this disease. But these disease-modifying drugs are because of the health system, and because the professionals in the health system haven't had to deal with brain disease, are slowly moving into the marketplace. And the perception that maybe cost, which they cannot take into account, supposedly, should be a factor, is just wrong. That's not really causing increasing costs for Medicare at the rate that they assume. And in fact, as Linda and Neil have just mentioned, people are willing to pay more for their premiums in order to get the coverage that they think they deserve.
Mm-hmm.
I think, Sue, also what's really flawed here, and having had personal experience with Alzheimer's with my mother and dementia, real people, 2/3 of real people know how much this costs already. It is an extraordinary financial burden on families. Honestly, $5 a month, my God, that would have been such a relief to have that be the cost. So of anything that would have made my situation better. So I think this is really, voters find it incomprehensible, honestly.
Yeah, I appreciate that. Thank you, Celinda. My mom currently is living with Alzheimer's, and I can relate. It's very expensive for care. And additionally, I mean, I just want to point out that one of the reasons why we wanted to do this poll was to send it to the presidential candidates and ask them what their thoughts were on this, and then also to send it to the current administration. Our organization, Us Against Alzheimer's, PFCD, and others, we've been working on these CED issues over a couple administrations. And one theme that we repeatedly see is the executive office tends to have a very hands-off approach towards CMS and the Medicare program regarding coverage with evidence development. And we just don't think that they can pass the buck any longer. They need to actually have a position on it and let us know where they stand. It's not okay anymore to just say, oh, it's too technical and we got to just let the Medicare program run itself. This is discriminatory, and we're looking for a stance on this. And that's part of the reason why we did this poll.
I would say, in addition to your point, Sue, a Republican administration, which probably supports the efforts of the Supreme Court to limit the independent authority of these agencies to do what they will, I think may be inclined to cut back on CMS's authority here, simply because CMS is doing these restrictions on insurance access really without any authority from Congress. This is basically a CMS that is taken it under its own hands, and without real statutory authority to do what they're doing. So that would suggest that the Republicans might be more favorable, but I think the Democrats are equally supportive of this policy. As you mentioned, Celinda, This disease does not know Republicans from Democrats. It attacks us all. And so I think that a Republican or a Democratic administration, perhaps for different rationales and reasons, would hopefully cut back on the authority that CMS is asserting here.
Mhm. My next question is for both Celinda and Neil. Celinda, you made a comment about how there's increasing sentiment about doctors and patients making their own decisions in the country right now. Can either of you give a little bit more background on that?
Yes, and I mean, it's an issue for an entirely different webinar, but because for women in particular, the whole issue of abortion, Roe v. Wade, is so prominent. What we've seen is the numbers go from about 40% of people that think people and their doctors should be making decisions, and that's a core principle, because people thought, well, it wasn't an issue. Of course, people and doctors are making their decisions. To
Right.
now over 2/3 with real intensity among women, because they think in general, wait a minute, this cannot be assumed anymore, and I'm really feisty about it. So that's what I meant. I don't want to bring in a different issue, but we've just seen that sentiment really soar with the public.
Yeah, there's no question that abortion may not be on the ballot in most states in the country, but it is on the ballot.
Mhm.
And all you need to do is watch, TV advertising to know the role that abortion is playing in this campaign, as it did in 2022. But it does reinforce that kind of sense of message that that people should have a choice, and the choice should be between a doctor and a woman. But that's what that's what Slender is referring to, and there's no question that that's front and center for many Americans right now.
Yeah. I mean, there's definitely parallels because there is a paternalism on the part of CMS. At least it's a feigned paternalism in order to rationalize the policy, that somehow doctors won't know what to do. They don't have enough information. They're not capable of making the decision, even though, these drugs have gone through the same process as drugs for cancer and a lot of other conditions. And the Food and Drug Administration, who's actually empowered with the ability to determine safety and effectiveness, has done so. So the next question is to George around the blood tests. Can you just speak to the issue about blood tests related to heightened access and equitable care?
Yeah, one of the right now, the gold standard of whether you have amyloid and tau in your brain, which are the current view or the hallmarks of this disease, is determined by either a lumbar puncture or by a PET scan. Lumbar punctures are somewhat intrusive and really not accessible to many people who have problems with arthritis or other kinds of conditions. And PET scans are only available in large medical institutions by and large. So the number of people who actually can get a diagnosis of the disease, particularly a diagnosis at the early stages of the disease, is pretty limited. Not to the teens of people, but nevertheless pretty limited. But blood tests promise to be available in primary care doctors' offices, and 2 or 3 of these blood tests now on the market are equal in performance to CSF and PET, to lumbar punctures and to PET scans. And obviously, or not so obviously, but the blood test is something we do every day or every time we go to a doctor. So this is pretty understandable by patients, understandable by doctors as a way to determine whether you have amyloid or PET. And they're obviously much more accessible and lower cost. The cost of these blood tests, depending on the company offering them, can be in the low few hundreds. Now, that's not cheap, but if doctors are only compensated to the tune of $20 or $30 to actually do the test, doctors aren't going to do it because they're going to lose money on it. So what Medicare is proposing in terms of its reimbursement rates for these much lower cost, much more accessible blood tests is really unconscionable and, quite frankly, self-defeating, because the more we use of the blood test rather than our higher cost methodologies for detecting Alzheimer's, the more money in the end Medicare is going to save.
Great, thank you. Just want to remind folks, if you do have a question, to just put it in the Q&A function here, and we'll get to it as soon as we can. Our next question is there something unique about Alzheimer's here, or is this the camel's nose under the tent for Medicare to limit coverage of FDA-approved treatments for other diseases as well? George, you want to
Sue, I think,
go ahead?
no, I think you ought to take that one because you know exactly what is coming down the pike with this practice on the part of Medicare.
Sure. I mean, CMS has put out some strengthened guidance over the last couple of months on coverage with evidence development, on their national coverage analysis process, and then another guidance on medical devices and using CED more stringently to limit the number of nationally covered medical devices. And it's really clear from these guidances and from what representatives, really officials from CMS have been saying in public forums all over the place, that they are planning on doing this much more. I think it's also really important to recognize, the limits that were placed in the Inflation Reduction Act on the difference between small molecule and large molecule drugs. Large molecule drugs are the ones that are generally covered under Part B, which is where CED is applied. And those are the drugs where, we're hearing there's going to be more investment in future years because they've been given a longer exclusivity period before they're subject to direct negotiation. But Part B is exactly where CED will be applied. So we are actually seeing it as a bit of a trap. And that's something that we hope reporters pay attention to. I
Yeah,
also
well,
wanted to just throw it back to the reporter that asked the question about the campaigns. I really hope you go to the campaigns and ask them for their position on this, because we would love to know.
I just add one other thought. I think many Americans, before they're qualified for Medicare, are having the experience that private insurance companies are getting more and more sophisticated about how to deny claims. How to cut back, how to provide all sorts of preconditions on it, and in systematically figuring out how to invest in claim denial innovation, so to speak. Medicare is beginning to act like a private insurer. It is doing precisely the same thing. It is cutting back on its coverage limits. It is finding ways to deny coverage. And so what has started in the private sector as a pretty heinous policy is extending now to our public insurer, and with huge ramifications for the over 65 population, because Medicare is acting like a private insurer and finding ways increasingly to deny claims.
Mm. Okay, our next question is for the pollsters. Was it surprising that this issue is resonating across age groups, given that older adults in Medicare are the most affected?
I'd like to try and take a crack at that one, Slinda, then hand it over to you. I'm not sure it's surprising. What's really interesting as you're looking at the data, it is middle-aged and younger Americans are the ones who are taking care of and providing care for those people who are that are impacted by Alzheimer's. They see the impact on their loved ones. I think what is really that's really one of the most interesting parts of the survey is how it extends beyond just those people who are impacted into younger age cohorts who see the debilitating effect that this disease has on their loved ones. So I think it makes total sense, and I think that's a really important finding in the survey.
Mm-hmm.
I just want to underscore that it's a really important finding. And the second thing I would say is you have Gen Zers are the most involved with care of any cohort before. People don't realize this, but the data has been amazing. They're very, very involved with their siblings, younger siblings, and they're very, very concerned about their parents and grandparents. So I was surprised, honestly, at the intensity and the level. You also have communities like Latinos and African Americans, AAPI, where there's a strong tradition of younger people in the family caring for aunties and older relatives and parents. So that is also influencing. But frankly, I thought the numbers were astounding.
Yeah. Yeah. In rural as well. Do you have
Yes.
any comments there?
Well, I thought the rural numbers, were really fascinating. And there are two first here, the amount of care and the intensity around it, because, having grown up on a ranch in Montana, you don't have the supports. You can be in a healthcare desert. You can have to drive 100 miles to get the services that you need easily. And so I thought, but rural America has become increasingly Republican, and it just shows how bipartisan this issue is. The intensity that rural America was feeling, as intense, in some cases even more intense than suburban and urban America.
Yeah, it speaks to the issue George raised earlier, which is the breadth of the impact of this issue and how it knows no boundaries with respect to geography, gender, age, ethnicity, partisanship. It cuts across the board.
And I would just note that my own Wyoming, I'm not sure about Wyoming, but rural America does not have access to PET scans.
Mm.
They do have access to blood tests.
Yeah.
So we are finding an insurance a company here called Medicare that is denying rural Americans access to the diagnostic products that could be accessible to them.
Mm. So I have one more question, and then we'll have some closing comments, George, from you, and we'll close us out. My last question is for Celinda and Neil. If you were contacted by the campaigns and they said to you, what can you tell us about the swing states on this issue? What's your advice?
Well, we oversample battleground states in this poll, and swing voters who are independents, battleground states where the battle is going on, as their name would suggest, are very, very intense about this, and equally intense. So the voters that people are fighting over right now tend to be older non-college women who really feel scared about what's going to happen to them and sandwiched with care. They're independent voters who feel very strongly about this issue. And independent voters right now, the swing voters are more financially pressed. So the fact that they want to pay and are willing to pay this money is really, really telling, because they're quite tax sensitive. They're really inflation sensitive. And then the fact that the battleground states are as strong as any states. And really, these questions are really good questions. But what we find, honestly, is we have to get out of this question, because every group is really strong, and the divisions that we're used to seeing in these questions are very good ones and rightly posed. They don't exist in this data. They don't exist on this issue. You want a bipartisan issue in America? You want a united issue? This is the issue.
Wow.
Yeah.
Neil, I'll pass it to you.
Yeah, I went back and looked at those target states, and if anything, they may be stronger with respect to supporting these issues than the rest of the country, but only by a couple of points. What I would emphasize to a Republican campaign is, if you're worried about an issue that might cross pressure your base, this is not it. This does not cross pressure strong Republicans. They are on board. This is an issue that you can that can help with those more moderate voters in the middle, independents, those who are really, kind of agonizing with their decisions in Michigan and Pennsylvania, et cetera. It's a solid issue. I'm not sure they will make it an issue in the campaign over the last 4 weeks, because they're looking for contrast between Harris and Trump. But I would encourage either side that when you form your new administration, these are the kinds of policies that would make sense to work across party lines to appeal to voters on the other side.
Okay, great. Thank you both. That was terrific. Okay, so thanks again to Celinda, Neil, and George.
Thank you.
And thanks to everybody for joining us. I'm going to ask George if he has any closing remarks, and then I'll close us down.
Just two thoughts. When my wife and I started our advocacy 20 years ago, I'm a Republican, she was a Democrat. We called ourselves the Alzheimer's Party, simply because it was bipartisan and we found bipartisan support in Congress. But what's amazing to me is that so few presidential candidates, senatorial candidates, or House candidates speak of Alzheimer's in their stump speech.
Yeah.
Half of Americans, half of the people sitting in at their rallies and at their meetings and at their stop by, the local grocery store, drug store to make, half of the people they talk to will have had this in their family. Show some empathy, at least, to candidates. Whatever policy position you may eventually want to take, we would strongly urge taking Medicare out of the private insurance behavior category, but very much speak to the issue, speak to the empathy and the sympathy that you will get from your audience, whatever party you are. You should be a member of the Alzheimer's Party if you're a Republican, and a member of the Alzheimer's Party if you're a Democrat.
Excellent. Very well said. Thank you. I would just add that this poll to us, it shows that the American people get that Medicare is a payer and it's not their job. It is their job to cover and pay for FDA approved medications, but not to dictate clinical care. Voters seem to be very aware that this is a serious disease and that doctors and families with Alzheimer's are more than capable of making treatment decisions based on risks, benefits, and individual health needs, and don't need CMS's help. Thank you very much. They don't like what Medicare's done to restrict access to Alzheimer's treatments, and they want Congress and the president to step in if the agency doesn't change its ways. And they also say they'll vote for candidates who promise to make sure that happens. So our call to action is to ask the presidential candidates where they stand on this issue, and for President Biden, before he goes, to end CMS's restrictive CED on early Alzheimer's medications and provide national coverage without access barriers. All the materials from today are up on our website at agingresearch.org. And just want to thank everybody again for coming, and have a great afternoon.
Thank you, Sue.
Thanks, Sue.
Thank you.